The question of whether diabetics and prediabetics can eat fruit is one of the most common among patients, and the answer may surprise you. Yes, it is essential for these individuals to include fruits in their diet. Regardless of the stage of diabetes, fruits play a crucial role in maintaining a healthy life, contributing not only to glycemic control, but also to a range of other health benefits. Fruits, allies in health and glycemic control. Fruits are rich in fiber, vitamins, minerals, and antioxidants, all of which are essential for the proper functioning of the body. For diabetics, a balanced consumption of fruits can help regulate blood glucose levels. This is because the fibers in fruits slow down the absorption of sugar, preventing unwanted glycemic spikes. Additionally, fruits promote digestion, strengthen the immune system, and even protect against the development of certain types of cancer. It's important to debunk the idea that diabetics cannot consume fruits. This myth, which still circulates on the internet and even in casual conversations, is not supported by science. The secret lies in choosing the right fruits and consuming them in a moderate and balanced way. Criteria for choosing fruits. To understand how to choose the best fruits, it's crucial to know two concepts: glycemic index, GI, and glycemic load, GL. The glycemic index measures how quickly a food raises blood sugar levels. Fruits with a low GI below 55 are preferable for diabetics because they cause slower and more controlled increases in glucose levels. On the other hand, glycemic load considers both the GI and the amount of carbohydrates in a portion of food. Fruits with a low GL below 10 are even more beneficial as they combine a low GI with a lower total carbohydrate content. Now let's explore 5 fruits that are ideal for diabetics, considering their glycemic index and load, as well as other health benefits. 1. Passion fruit. Calmness in fruit form. Passion fruit is widely known for its calming properties. In addition to helping reduce anxiety and promoting sleep, it has a low glycemic index, making it ideal for diabetics. Studies indicate that passion fruit can increase insulin sensitivity, which is crucial for people with type 2 diabetes. Insulin is the hormone responsible for transporting sugar from the blood into the cells, and when the body's tissues respond better to insulin, glycemic control becomes more efficient. It's important to remember that to maximize the benefits, passion fruit should be consumed in its whole form and not as juice. This is because juice usually contains a larger amount of fruit, which can increase sugar content and reduce the amount of fiber. 2. Plums. Helping the liver and immunity. Plums are an excellent choice for diabetics due to their low glycemic index and load. Additionally, they are rich in fiber, which facilitates intestinal transit and helps keep blood sugar levels under control. Plums also have anti-inflammatory properties and can improve insulin sensitivity, especially in the liver, which is a key organ in storing and releasing glucose. The liver acts as a sugar reservoir, releasing it slowly into the bloodstream during fasting periods. This process is essential for keeping glucose levels stable, and consuming plums can help optimize this liver function. 3. Pear. The fiber champion. Pears are another fruit that should be on the menu for those looking to control diabetes. With a low glycemic index and load, pears are rich in fiber, which not only improves digestion but also helps keep blood sugar levels under control. The soluble fibers in pears form a gel in the intestine, slowing down glucose absorption and promoting a feeling of fullness, which can help prevent sugar spikes after meals. 4. Peach. Sweetness with health benefits. Peaches are a tasty and nutritious fruit with properties that go beyond glycemic control. With a low glycemic index and load, peaches are rich in antioxidants that help fight free radicals and reduce the risk of cancer. Studies also show that regular consumption of peaches can lead to a lower rise in blood sugar levels, making them an excellent choice for diabetics and prediabetics. Additionally, peaches have anti-inflammatory properties, contributing to overall health and strengthening the immune system. 5. Orange. Vitamin C that strengthens. Finally, we have the orange, a fruit widely known for its high vitamin C content. In addition to strengthening the immune system, oranges have a moderate glycemic index and a low glycemic load, as long as they are consumed whole and not in juice form. Oranges also help prevent kidney stones, a common problem among diabetics. As with passion fruit, orange juice should be avoided or consumed in moderation, because the sugar content can be significantly higher when the fruit is processed. Fruit consumption is not only permitted but recommended for diabetics and pre-diabetics, as long as it is done consciously and in moderation. Choosing fruits with a low glycemic index and load can help control blood sugar levels and offer a range of other health benefits. As always, balance is key. Consuming fruits in adequate portions and avoiding excess ensures that you can enjoy their flavors and benefits without compromising your health. If you enjoyed this content and want to learn more about other fruits and foods suitable for diabetics, don't forget to leave a comment and subscribe to our channel for more informative videos. Knowledge is power, and together we can continue to learn how to live a healthier and more balanced life.